Mike Buckley, journalist and broadcaster, joins us now. Hi, Mike. I'm not sure how much you caught of Sajid Javid, the new health secretary in Parliament, but he said that the 19th of July remains at the government's target date for easing restrictions. For me, he said, the 19th of July is not only the end of the line, but an exciting new journey for our country. Your reaction?
I'm not quite sure what he means by an exciting new journey, because we've
more restrictions.
We've had a terrible pandemic, as you know, and coming out of lockdown, when we eventually do come out of lockdown, and I, like you, I hope that it is the 19th of July. You know, we've got huge numbers of people, of course, have died. We've got huge numbers of people who've got long COVID, including children who've got long COVID. We've got lots of businesses who are continuing to struggle. We're likely to see joblessness go up as the furlough scheme comes to an end. So I do hope that it is a new dawn or an exciting new journey for the country. But I think we've got lots of challenges ahead. I don't mean to be the pessimistic, gloomy one coming onto this call, but
well, we've got challenges ahead, Mike. We've got challenges ahead, not because of COVID, but because of lockdown.
We've got challenges ahead because we've been in a global pandemic and because our government has made a number of very, very bad choices. And in my view,
such as shutting down the economy for the best part of 15 months.
Such as going into lockdown too late, which on at least 3 occasions, which has meant that lockdown needed to be too long, longer than it would otherwise have been.
Even though cases were falling before each of the national lockdowns, as demonstrated by a peer-reviewed study by Professor Simon Wood.
I don't think, well, certainly I would disagree with you on that. I don't think you can argue that the lockdown...
Speak to Simon Wood. He's the prof, not me.
I'd be very happy to do so if I ever get the opportunity.
So what about the comments of Jonathan Ashworth, who is, of course, the opposite number to Sajid Javid, Mike? He asked the health secretary what he'll be doing to push cases down. And he also suggested that the 19th of July might be premature. Why has the new health secretary got to push cases down?
Well, we've got an R rate of 1.2 to 1.4, so cases are going up. Even if you don't care about, even if you think that hospitalizations and deaths are going to stay low, and the data seem to show that actually we will get significant numbers of people going into hospital and dying in the future.
We're on 1% at the moment, so we've got a little bit of headroom.
We have, but data from the vaccines, I think it's 4% of people who've had both doses of Pfizer are likely to end up in hospital. Some of those people will die. 8% of people who have had both doses of AstraZeneca are likely to be hospitalized. Some of those people will die. Now, a piece I was reading the other day says that if, and it is an if cases continue rising at the current rate, we're likely to be seeing 60,000 cases a day by the end of July with restrictions as they are. Now, it doesn't take, I'm not a mathematical genius, doesn't take a mathematical genius to work out that's a hell of a lot of people. 8% or 4% of a hell of a lot of people is still lots of people dying or being hospitalized. So we may get to the point where the NHS is overwhelmed. I really hope that those things don't happen, but it isn't my choice. It's the choice of, well, it's the choice of what the virus does. It's the choice of what we do as individuals. Do we keep ourselves safe or not? But it is also still the choice of what the government does. Does the government put any restrictions in place? Do they not? If they do, and I hope they don't have to, but they may, then it will be far, far worse. And the next lockdown, if that happens, and it is an if, will be longer and more harsh than if they put restrictions in place. You know, if they'd not done stage 3 on 17th of May, if they'd controlled this virus back in April, mid-April, when we were aware of it, we knew it was growing exponentially then, but we did nothing to stop its spread or to stop its growth. So
well, we've seen countries that had far stricter lockdowns than us, Mike, and earlier lockdowns, some of the highest COVID death tolls in the world. There isn't a country on the planet that did nothing that has seen a cricket score death toll from COVID that particularly contrasts with countries that lock down hard. I mean, Dominic, what's your reaction to what Mike had to say, that we should worry about cases and that perhaps the 19th of July is premature, to paraphrase Labour's John Ashworth?
Really aren't backed up by any data. I mean, a number of the predictions that scientists made that supported the government's roadmap just haven't materialised. It's a fact now that their predictions about hospitalisations round about now have been wrong. Hospitalisations are far lower than they predicted. The R rate of 1.2 to 1.4, I mean, it's been like that for a while, because I looked myself to see if the R rate was rising exponentially. It's not. Scientists predicted that it would effectively double as soon as we started opening up, particularly with schools, and that didn't really happen. There won't be 60,000 cases a day. People are vaccinated. The vaccine does work, specifically for elderly and vulnerable people, which significantly reduces the likelihood of them being seriously ill or dying from coronavirus. And we see the evidence of that. And this is the bizarre thing. Over 22,000 cases today, with 3 deaths recorded. The link between deaths and cases has clearly been broken. So what we need to do is scale down testing and focus upon the hospital occupancy and deaths. And right at the moment, we're in a really good place. And just lastly, on the point of people dying and being hospitalised who are double vaccinated, there was an explanation for that, because that was actually predicted before the government announced its roadmap. This was in the report, and they said that that would happen. But that's because most of the people that got the vaccine early were the vulnerable and the elderly, and they'd be more at risk to their own immunisation failures than an unvaccinated person. So what we need to really think about is the realism in this, and that people who are vulnerable and who are elderly are going to die. What we need to do is prioritise opening up the country and trying to salvage some of the absolutely detrimental impacts that this lockdown has had on young people in particular. Let's start thinking about them.
Yes, I mean, Mike, when will Labour make an equation between economic damage and the loss of life? The so-called low-level restrictions are still having an impact on GDP. There is some speculation that the 4-week delay to lifting of all restrictions will cost 2% to the nation's finances across a year. Bottom line is, wreck the economy, you wreck lives, and also you cost lives.
But the solution is to control the virus so that you can open up the economy. If you look at Australia, New Zealand, and a bunch of other countries as well, they've controlled the virus by controlling the borders and having
the geography of the Antipodes is unique, Mike. You need to compare us to Germany, France, Italy, Spain, the United States.
Well, those countries have all made mistakes as well. There are other countries which have different geographies to ours and similar geographies to ours, which have made much better efforts at controlling this virus. I mean, you look at how New South Wales, for example, is dealing with a very small outbreak of the Delta variant compared to ours. They can trace people to where they were and where they picked up an infection, down to a minute, because they've got a system that works. We could have the same system here. We've got the same technological ability. We've got the same, wealth, or possibly more wealth than those countries. I don't even know. We could do the same things. We've chosen not to. We've chosen to kill people in our country. We've chosen to give people long COVID in our country, and we've chosen to screw our economy. We could have made different choices, but we haven't. I hope at some point in the future that we do, and I certainly hope that in the next pandemic, were it to occur, that we would make better choices next time around.
And borrow another £1 trillion and wreck many more lives and close down once viable businesses, and yet still boast one of the highest COVID death rates in the world. Well done, everyone. Final thoughts, Dominique?
I just think a lot of these arguments that people are presenting now, with the evidence that we have now from different countries, they just don't stack up. You guys really need to search for new arguments, because even in countries that were lauded how great they dealt with the virus, now have seen themselves really in similar positions. There was a study done on countries like ours, Italy, Germany, and what they found was that, early lockdown actually didn't do anything to prevent deaths long term. Of course, lockdown does help with stopping the spread of infection, but in long-term prevention of death, lockdowns actually don't really work to prevent that. We've seen in Israel, where over 90% of their population has been vaccinated, because of a small rise in cases, they're now reintroducing mask mandates. In Australia, they're going absolutely insane, locking down millions of people because of a minuscule amount of cases, despite the fact that they were lauded for being so perfect with their border policy. The Delta variant still got in. Jacinda Ardern is going insane, saying that mandatory masks might need to be introduced in certain areas, and QR code scanning. These arguments are really recycled, and they're old now, because no matter what, the virus still is able to get in. So we need to be really realistic about the way that we approach it.
Final thoughts from you, Michael?
I have no quarrel with Jacinda Ardern, or I can't remember the name of the Australian Prime Minister, but I have no quarrel with political leaders who are doing everything they can to save lives and to keep the virus out of their countries. And I mean, obviously what you guys are interested in is an open economy. I'm also interested in an open economy, because I think people should be able to run their businesses, they should be able to live their lives. But doing that in a country where there is no coronavirus, or there's very, very little coronavirus, has better long-term economic outcomes as well as better public health outcomes. I don't think it's not controversial.
Zero COVID, Mike. It ain't happening. You'll never achieve it. And by the way, I've obviously quoted Sweden a lot, and we've seen states in America, including Florida and Texas, that lifted restrictions months ago, saw cases fall. California have just finally unlocked, boast a very similar COVID death toll, if not slightly higher than that of Florida. What about India, who didn't have the resources with which to pay millions of people to stay at home? They didn't have a furlough scheme. They've got grinding economic inequality, densely populated cities, very, very low quality public provision in terms of healthcare, and cases went up. They've got the Delta variant, of course, Mike, and now cases are down. They've got a lower per capita death rate than us.
India is a tragedy. We will never know how many people died in India because they don't have the ability to record.
So we're just doing a Donald Trump now and calling it fake news that they have a lower per capita death rate than here in the UK.
No, I'm not calling it fake news. I'm simply saying the Delta variant has been through that population. It has killed probably, at least tens of thousands, if not hundreds of thousands or millions of people. So I don't know.
In a population of well over 1 billion people.
It's killed a lot of people every life.
And cases are down by 75%, and they did nothing because they couldn't do anything. Because you can't control the virus, Mike. Virus.
You can control the virus. That's the whole point of vaccines, isn't it? But it's also the point of other mitigations like lockdowns and ventilation in schools and lots of other things that we're not doing.
Waste of time. But Mike, look, I really do appreciate your thoughts.
I disagree.
Well, look, I know, and I'm very glad that you take a different view, because that's what the show's all about, and that's why you're so valuable a voice. And many will agree with what you've said, and I appreciate your thoughts on it, as do I appreciate the thoughts of Dominique Samuel.